Welcome viewers to an in-depth look at small fiber neuropathy, a condition that, while often overlooked, can significantly impact quality of life. We'll explore its causes, effects, diagnosis, and management, shedding light on this often misunderstood disorder. So, what causes small fiber neuropathy? The truth is, in many cases, the exact cause remains a mystery. We call this idiopathic small fiber neuropathy. However, a number of conditions are known to contribute. Diabetes, especially when poorly controlled, is a major culprit. Autoimmune diseases like lupus, Sjogren's syndrome, and rheumatoid arthritis can also damage small nerve fibers. Other potential causes include infections such as HIV and hepatitis C, genetic mutations, celiac disease, certain medications, and even exposure to toxins like alcohol or chemotherapy drugs. Identifying the underlying cause is crucial for effective treatment. To understand small fiber neuropathy, we need to delve into the pathophysiology, what's actually happening to the nerves. Small nerve fibers are responsible for transmitting sensory information, particularly pain and temperature, and for controlling autonomic functions like sweating and blood pressure. In small fiber neuropathy, these nerve fibers are damaged or dysfunctional. This damage disrupts the normal transmission of signals from the skin and organs to the brain, leading to abnormal sensations and autonomic dysfunction. The exact mechanisms of damage vary depending on the underlying cause, but often involve inflammation, demyelination, damage to the protective coating around the nerves, or direct injury to the nerve fibers themselves. Pinpointing the exact epidemiology of small fiber neuropathy is challenging, partly because it's often underdiagnosed. However, research suggests it's more common than previously thought. Prevalence estimates vary widely, but it's believed to affect a significant portion of the population, especially those with diabetes or autoimmune conditions. As diagnostic techniques improve, we're likely to see a better understanding of how widespread this condition truly is. It affects people of all ages, genders, and ethnic backgrounds. The symptoms of small fiber neuropathy can be diverse and often debilitating. Pain is the most common symptom, and it's frequently described as burning, stabbing, or electric shock-like. This pain can be constant or intermittent and is often felt in the feet and hands, spreading upwards over time. Other sensory symptoms include tingling, numbness, prickling sensations, and extreme sensitivity to touch, known as allodynia. Autonomic dysfunction can also occur, leading to symptoms like dry eyes and mouth, excessive or reduced sweating, lightheadedness, bowel and bladder problems, and even erectile dysfunction. Because these symptoms can mimic other conditions, accurate diagnosis is crucial. Diagnosing small fiber neuropathy typically involves a combination of clinical evaluation and diagnostic testing. A thorough medical history and neurological examination are the first steps. Quantitative sensory testing, or QST, can assess the sensitivity to temperature and vibration. The gold standard for diagnosis is a skin biopsy. This simple procedure involves taking a small sample of skin, usually from the lower leg, and examining it under a microscope to count the density of small nerve fibers. A reduced number of nerve fibers confirms the diagnosis. Nerve conduction studies, commonly used to diagnose large fiber neuropathy, are often normal in small fiber neuropathy, as they primarily assess the function of larger nerve fibers. Additional tests may be performed to identify the underlying cause, such as blood tests for diabetes, autoimmune markers, and vitamin deficiencies. While small fiber neuropathy isn't typically classified into distinct types, like some other neurological disorders, it's often categorized based on the underlying cause. For example, we might refer to diabetic small fiber neuropathy or autoimmune-related small fiber neuropathy. Understanding the specific etiology guides treatment strategies. Currently, there's no cure for small fiber neuropathy, so treatment focuses on managing symptoms and addressing the underlying cause, if identified. Pain management often involves medications like gabapentin, pregabalin, duloxetine, and tricyclic antidepressants. Topical treatments like lidocaine patches or capsaicin cream can also provide localized pain relief. Physical therapy can help improve strength and flexibility. For autonomic symptoms, specific medications may be prescribed to address dry eyes, constipation, or other issues. If an underlying condition like diabetes or an autoimmune disease is identified, treating that condition is paramount in slowing the progression of the neuropathy. Preventing small fiber neuropathy often involves managing risk factors. For individuals with diabetes, maintaining tight blood sugar control is essential. Healthy lifestyle choices, such as regular exercise, a balanced diet, and avoiding excessive alcohol consumption, can also help protect nerve health. Early detection and treatment of autoimmune diseases can also minimize nerve damage. Avoiding exposure to toxins, where possible, is another important preventative measure. The prognosis for small fiber neuropathy varies depending on the underlying cause and the severity of the condition. In some cases, symptoms may remain stable for years, while in others they may gradually worsen. If the underlying cause can be identified and effectively treated, symptoms may improve or even resolve completely. Recent research is focused on developing new and more effective treatments, including targeted therapies that address specific mechanisms of nerve damage. Studies are also exploring the potential of regenerative medicine approaches, such as stem cell therapy, to repair damaged nerve fibers. While these advances are promising, further research is needed to fully understand their efficacy and safety. Ongoing research provides hope for improved treatments and a better quality of life for individuals living with small fiber neuropathy.